Hi, so we are group 15 for Informatics 171. My name is Candy. I'm Jasmine. I'm Danica. Cal. And I'm Amberly.
So today we will be talking about telehealth. We will first go over the first article and how technology can be implemented in healthcare provision. There has been an increasing pressure to explore new ways on how to implement healthcare outside of the traditional clinical settings. This has been characterized as technologically enabled self-care and disease management at home, which has challenges. This type of care will require an active role of patients in their own care, in which they will have to relay information to clinical teams in order to reach a consensus on their treatment. Technological tools such as EHR and Apple Watch can be helpful in creating a collaborative activity system in chronic health care. This integration of self-care in patients' lives can potentially lead to transformation of existing structures of care provision in chronic illnesses such as cystic fibrosis.
Treatment faces challenges with adherence and self-management due to its complexity. Due to this, combining regular in-clinic follow-ups with home-based self-care is needed so the burden of care is more equally shared between the doctor and patient. Some technology like game-based breathing exercise apps and home-based lung function tests supported by regular telephone engagement was shown to increase adherence. So technology could help with this problem.
Due to the demanding nature of cystic fibrosis treatment and self-care, there is difficulty in maintaining patient retention and attendance to appointments. Many patients spend several hours a day performing self-care treatments as well as exercising in order to reduce mucus in their lungs. Moreover, as the disease progresses, patients find that they need to spend more time during the day performing treatment. This is disruptive to their lives and careers. The use of technologies tries to combat that burden that CF patients undergo by decreasing the number of appointments that they must attend with personal data collection.
So in more recent times, wearable and home-based technology have been accepted in a more positive light. It allows patients to be more self-aware of their own health. This technology improves timeliness and can reduce doctor visits in that since patients are able to help with their own monitoring. This changes the nature of the clinical encounter in that there's more of a holistic view and that the problem may be addressed at an earlier time. Just some examples of how this technology can be used are through video calls and remote clinics.
The use of remote technology weakens the relationship between patients and their physicians within collaborative care. Moreover, the structure of technology generalizes the treatment and experience of all CF patients or clinical teams in all cultures and settings. It points patients in a direction that may not be applicable to them. The main goal of technology is to facilitate the treatment of CF patients by supporting the goals and priorities that are meaningful to their lives in order to maintain patient retention. In conclusion, for technologies to support self-care and the wider activity system of chronic health care provision and to be successful in chronic conditions such as cystic fibrosis, they must be well integrated and grounded in the lives of people living with those conditions.
90% of healthcare organizations prefer to use telemedicine service because it can boost care coordination, and these are the statistics on how telehealth is currently implemented in U.S. hospitals and health systems. Although a lot of physicians want to use telehealth services, there are still barriers to integrate that. Here shows some of the barriers to integrate.
I believe telehealth is innovative and will be detrimental for the future of healthcare. Its innovation allows for the collaboration between patient and healthcare provider, which can give an overall better assessment of the patient's condition over time. Telehealth will be useful especially for those with chronic conditions, as it can allow insights into their life and better understanding of their life, thus transforming the nature of care provision in that particular chronic illness.
Telemedicine is a step up to increase physician-to-physician coordination. As I was a part of Team A2 for the opioid crisis hackathon, I know that integrating telemedicine within the current internal physician management tools would definitely help more physicians to prescribe medicines for opioid use disorder patients.
With our society being more reliant on smartphones and mobile devices, telehealth will also continue to evolve. And this is just because these technology trends are fueling the expansion of the telehealth industry, in that more healthcare providers and their patients use and depend on more digital health-related services such as electronic health records. A great example of this would be real-time patient to doctor communication and more remote or even at home patient monitoring.